So hello everyone, it's an honor to be back here on the seat where I found myself almost on a daily basis a year ago during the first wave of the pandemic. Thank you for the invitation. Who has since been here, the person who has been here replacing me to mention the essential work that is done by the parliamentary press since the beginning of the pandemic. And we are going to be celebrating the first anniversary this year. That being said, without any further ado, welcome to this press conference to go over the situation in Quebec about COVID-19. The Premier of Quebec, Mr. François Legault, is together today with the Minister of Health and Social Services, Mr. Dubé, and the National Director of Public Health of Quebec, Dr. Horacio Arruda. Mr. Premier. Well, hello, everyone. Of course, we have some special emotions today. It's been almost a year that here, on this stage, I was announcing that Quebec was about to put itself into emergency mode, and we know what happened after. I've said it often, and I repeat it. I've been so impressed to see how Quebecers have followed the guidelines. We've even had studies that showed that it was here that people were following the guidelines the most. So Quebecers really showed a lot of solidarity. We found out pretty quickly that it was mainly the elderly who were affected, but all Quebecers, whether old or not, were careful, they followed the guidelines, and it was truly a gesture of national unity that I will remember my entire life. And of course, we have to thank all the caregivers, all those who have given essential services, amongst others, at the beginning of this pandemic, where we were in unknown territory, where some people might have been very scared of catching the virus, but still went to work. And I want to give a special thanks to you, the journalists, and particularly to Marc-André Gagnon. Very nice gesture on the part of Marco to give him back his seat that he had during the entire springtime. You yourselves, you know, we were all in this room. At the time, you didn't wear a mask, but we were still careful to keep a certain distance, and it was managed very well. Marc-André Gagnon learned, like we did, a little bit as we went along, how to have questions in a very different scrum that lasted an hour. And you've also succeeded in transmitting the guidelines very well, since, yes, there was television. There were some of you who commented. Some people wrote, of course, and some other people on the radio. But we're all in the same boat, and I'd like to take this opportunity to say thank you, particularly to Mr. Gagnon, for having managed that period so well. Of course, there's not just good memories, there's bad memories. 10,493 deaths up until now. Yes, on Thursday, it will be a year that the World Health Organization officially declared the world pandemic. So we'll take advantage to have a ceremony, a kind of national mourning day, in memory to all those who have disappeared and their loved ones who are still suffering today of the disappearance of their loved ones. I would just like to take a few minutes, perhaps, because there's a lot of Quebecers who, after a year, are thinking, could we have done things better? And the answer is yes, we could have done better. But at the same time, we have to remember the context. First, when we look at the 7 richest industrialized countries, 5 of them had more deaths, if we look at it proportionally, than we. And, you know, amongst them, France, the United States, Spain, Italy, the United Kingdom. In the past year, all proportions being kept. More countries that had fewer. Those are Germany. However, Germany, you'll notice that they had fewer deaths than we did during the first wave, but more during the second wave. So it remains Canada. Of course, we have to look at particularly those provinces that have large cities like Ontario. And yes, Ontario had fewer deaths than Quebec. Experts are still analyzing why. One of the important possibilities is the spring break, because, of course, the virus did not fall out of the sky in Quebec in March 2020. The virus arrived in Quebec with travelers coming back. The spring break ended up being at the worst moment at the beginning of March. We know that in Ontario it was planned on 2 weeks later, and because of the pandemic, in the end, it was cancelled. But when we look at the states that are close to us, like Massachusetts, that includes, of course, the city of Boston, one of the richest states in the world, one of the best healthcare systems in the world, that has 4.9 million inhabitants. I repeat to you that we're 8.5 in Quebec. They are 4.9, where we're at 10,493 deaths due to COVID. Massachusetts is at 16,435 deaths because of COVID. And I don't think that we can say that their healthcare system is no good, that they haven't made the right decisions. But they have something in common with us. They, too, had a spring break in the weeks right before the first wave. Despite that, even once we put that context in, we can still ask ourselves, could we have done better? And yes, we could have done better. Of course, in CHSLDs, we've repeated it quite often. And I've admitted right at the beginning, it's been many years that we were lacking thousands of staff members in CHSLDs. And the governments, including mine, did not act quickly enough before the pandemic. So we ended up in a situation where we were missing about 10,000 employees before the pandemic even hit in CHSLDs. And with the pandemic, it added another 10,000. So we were now missing 20,000 people. Those who are here, I recognize some faces, will remember. And we on our end, missing 20,000 employees out of 40,000, that is a lot, quite a lot. First, once again, I want to say how proud I am of Quebecers. When we announced the Je Contribue website, 20,000 Quebecers went to work. People, for the most part, who had no specific training in health, but who came and helped out in CHSLDs. Despite the virus, despite the risks. And that, too, I will remember my entire life. Of course, during the summer as well, we corrected a lot of things. There are 8,000 employees whom we trained and who are now in CHSLDs, or 7,600, but there's another 800 who are finishing their training. So we're going to be at over 8,000. Our objective is to increase that to 10,000. We made sure as well to have now a boss in each CHSLD, amongst other reasons, to be able to follow the inventory and usage of masks and protection equipment. And we saw an improvement of at least 90% in CHSLDs when we look at the second wave as compared to the first. Things, however, are not yet finished. It's quite something. Some people were reminding me that we had put Quebec on pause for a few weeks, and now it's been a year. In certain cases, those are, very great efforts that we're asking of Quebecers, but it's not over. We're vaccinating, and things are going well. And I want to thank Christian Dubé and his team. I don't know if you're like me, but I don't know if it's just to make me happy, but I've had a lot of calls, a lot of emails from friends who said, I went with my parents and grandparents, and it was faster than I thought it would be. It was well organized, so bravo. And in Quebec, we are the province right now, proportionally speaking, who has vaccinated the most. I see Christian every day who's not happy, who wants things to go even faster. So we are going to go even faster, and the idea is to say that as the doses arrive from Ottawa, and we can see that it's going to increase a little over the next few weeks, well, we want to administer them all as quickly as possible, because our obsession is that all people who are vulnerable, of course it means a lot, people 65 and over, I repeat it, 80% of hospitalizations are those people who are 65 and over. 95% of deaths are people 65 and over. So it is certain that once we'll have vaccinated all those people who are 65 and over, as the English like to say, it will be a whole new ballgame. It'll be a completely different situation. Christian is really, making a lot of efforts with his teams, and I'm after him as well to keep going. So it's a question of weeks now. It's coming. Of course, I also, I'm always after Dr. Arruda and his team, because I'm thinking that, once everybody who's 65 years and over will be vaccinated, I hope that we'll be able to visit people at home. He seemed to be wanting to say yes with certain reservations, of course. But I can tell you that public health is working really hard. Right now, they're working on sports. They're working on secondary 3, 4, 5 to go back full time. They're talking about places of worship and performance halls, and they have a lot of pressure, not just from me, because I get a lot of comments, but Dr. Arruda as well. And of course, we are not insensitive. I am not insensitive to what I saw over the weekend, the protests for sports. Those who know me a little bit know that I love sports, particularly hockey and tennis, but all sports. And for me, yes, my boys don't want me to talk about them, but they go play outside, they go snowboarding a great deal better than me. And sports is important for young people. It's important for mental health. And I want to tell you, because there are people who are saying that public health is forgetting about mental health. I just want to tell you that that is part of things that are taken into account by public health. Public health, I remember back in my old life, while I was for 1 year Minister for Health, in public health we spoke of prevention, we spoke of determinant factors, of tobacco, of all sorts of things. So health includes mental health. It counts, and sports reduces stress. It's a great deal better than any kind of medication. So public health knows that. And we talk about it every single day. Even this morning, again, we talked about sports. We talked about secondary 3, 4, and 5. And I want to be quite clear, because some people say, because in the past I've done it, I want to be quite clear that right now we're not opening sports more because public health believes that it's not time to open that valve back up. So it is a decision of public health. And when I say public health, there are people who send very nasty messages to Dr. Arruda. First of all, there's an entire team around Dr. Arruda. There's at least 4 or 5 doctors that I can see, and I know that there are some regionally in each region as well. So I would say that there's at least about 10 expert doctors who agree with Dr. Arruda. So it's not just the opinion of one person, it is the opinion of experts. And they are concerned because the variant has taken more and more room, and it is more contagious in young people, amongst other things. And the spring break, it takes 10 to 14 days to see the results. So we can't say here were the impacts of spring break on the spread of the virus. So I want to repeat, I listen to public health. And we can't say Let's listen to science, except when we don't want to. And leaders in our society, the leaders of our society have a responsibility. They can't just go out and say, I'm against this. I don't like restrictions in sports. I'm against the fact that people in secondary 3, 4, 5 are 1 day out of 2 learning remotely. If they say that, that means they're against science. That means that they're against public health. And I understand that the public is tired. And generally speaking, we're all tired. But our leaders have a responsibility, and we also have to show solidarity towards our elderly who built Quebec. I understand that it's not as risky for young people. It's riskier for the elderly. There are impacts on the mental health of younger people, and once we balance all of these things out, public health says we can't go further in sports right now. However, on Friday, Isabelle Charest is going to come here with public health to announce to you a plan, a gradual plan, to start sports again in the course of the next few weeks if the conditions allow it. That means once we'll have seen the results and the impacts of spring break. But today, public health is not ready that we go further in opening up sports. And I wish for all of our leaders, including here at the National Assembly, show solidarity and that they be responsible and that they support science and public health. And there's another subject that I find really sad, and those are the parents who are keeping their children at home from primary school because they don't want them to wear masks. First, children can adapt themselves a great deal more than we think to wear a mask. Secondly, it's not for fun that public health is saying, as we've seen in many other places in the world. I mean, in Ontario and France, they're also doing this, and it's not because we're crazy. Children in primary school, it's dangerous not to wear the mask right now with the presence of the variant. So children in primary school in red zones have to wear a mask. And I find it so sad that some children are prevented from going to school because some parents disagree with the measure taken by public health. I find it very, very sad that they are robbed of this. For a year now, I've been doing everything that I can to keep our schools open as much as possible because it is so important. It's primordial for our children. It makes no sense today that there are parents keeping their children at home because we're asking that the children wear a mask. The last thing that I wanted to say, it is important, even if we are now getting to the end of this, that all people who have symptoms go get screened. We're realizing, and have been for a certain while, that there are fewer people who accept getting screened. So when you have a symptom that looks like a cold or the flu, please, once again, it's a question of solidarity. Do it for yourself, yes, but do it for people who are close to you, for people who will be close to you over the next few weeks or days. You have to go get screened, and of course we have to trace all the contacts in order to isolate as quickly as possible those people who have COVID. So, I conclude by saying that we still have a few weeks where we have to be prudent. It's been a year that we've been resisting. We're not going to stop now, a few weeks away from the goal. The winter's almost over. Beautiful weather is coming. I ask you once again for your collaboration, and I thank you.
Good afternoon, everyone. It's been almost a year since I announced that Quebec was in a state of emergency. If I look back, I remember the incredible solidarity of Quebecers. Everyone has come together in a spirit of national unity, which make me proud. But we also registered many deaths. On Thursday, we'll hold a ceremony in memory of the victims. It will be a day of national mourning in solidarity with their close ones. A lot of people made great sacrifices in the past year. Our young people have had to sacrifice their sport for months. I know how difficult it is, but the public health make recommendations to save lives, and we cannot go against that. We're not happy to do this, but we have to stay careful. On Friday, Minister Charest will announce our plan to reopen sports in the next few weeks. It will come back as soon as possible in a secure way. We're getting closer to the finish line with the vaccine. We are ready to step up the pace. All the doses that we'll receive will be administered quickly. But we must continue all our efforts in the coming weeks. The contagion is still important. The variant is more and more present. I ask you to get tested as soon as you have symptoms. We've been fighting the virus for a year. I know we can continue a bit more. I'm counting on you all. Thank you.
Très bien, merci, Monsieur le Premier ministre. Alors maintenant pour les questions.
Thank you, Mr. Premier. Now for questions. Yes? Sorry, Mr. Gagnon, I just want to say a few words on the vaccination because, first of all, our experts have revealed how and when we are going to give it to whom. Particularly, we're going to be giving the AstraZeneca vaccine over the next few weeks. In fact, we are going to reserve a part of these doses for home vaccination. You remember we had talked about it a few weeks ago about how we're going to work on home vaccination. So I think that it's very good for logistical reasons, amongst others. And I think that it is a very good news to confirm that many people with whom we're going to, certain clientele, we're going to be able to get there directly rather than them having to move around and go to a vaccination center. There are doses that have arrived this morning, so we're going to be able to accelerate the movement with AstraZeneca. That's excellent news. Now, and I think that for the start, we're going to talk about 20,000 that are going to be sent to home vaccination. The rest we're going to be using in our mass vaccination centers. I would like to give everyone a reminder that we're starting to have a good arsenal. I'm not going to make any comparisons with cars. I've had my lesson, but I think as a summary, I would say that Pfizer, we're going to take them for what we call our mass clinics. Moderna is for our pharmacies, and I'd like to make a reminder that our pharmacies, we are to start next week with that. And AstraZeneca is going to be for home. That's really how we're going to allocate our 3 suppliers that we have right now. The other good news right now, with the different good news that we've heard from our manufacturers, it's 1.1 million doses that we're going to receive by the end of March. So when I add what we've had up until now plus the 1.1, it's probably going to be around 1.7 million that we should have had between December and the 20th of March, a little bit more than we had anticipated. And so that's also good, and that's why the Premier is also putting a lot of pressure to get all of those vaccines out as quickly as possible. 200,000 available this week, as a reminder. So you'll see an increase. You saw in the past few days we're vaccinating a little bit over the weekend. It was almost 20,000 per day. We went down a little bit over the weekend because we had about 30,000 left. If the 2 other vaccines were not to arrive in the upcoming days, we would have missed vaccines. We had about 30,000 left. The good news is that with another 200,000 ahead of us right now, we're going to be able to increase. And that is very good news. And I asked Madame Savoie this morning, as soon as I had a confirmation that the AstraZeneca and Pfizer vaccines did come in, I would invite people. So we've added schedules today for the Montreal region, the Laval region, because very often when people call, we told them, in Montreal, for example, there's no room left, but you can come back in 2 or 3 days. Now you can go over the web, and if there were people who were available to get vaccinated today and tomorrow in the Greater Montreal region, well, we still have some appointments left. We've increased that because there's more vaccines. So we'll be able to have an increase in the pace. So go back on the web or make phone calls to go get those appointments which were not even available this morning. I would also invite people 75 and over to go on Clic Santé, at the exception of Montreal, where we're at 70 and over. And I want to announce to you right away that perhaps even when we see one another again on Thursday or Friday, we will lower the age because it is going pretty quickly. And for the reasons that we know, we want to get to 65 and over as quickly as possible. I would like to ask people to have the moral contract, to give their age correctly when they make the appointment, because there's no way for us to check over the internet whether you're telling us the truth. So we ask you to respect your age categories to be able to record things properly. The second message that I want to give about vaccination, I had the opportunity yesterday of having a long conversation with the intersyndical people. So those are the main unions in the health sector. And we talked a lot about vaccination. And as you know, we perhaps had some issues with certain CHSLDs at the beginning of the year where the question of vaccination was perhaps largely an unknown. Our first CHSLDs, I'm thinking in the Outaouais region, for example, in Quebec, there was a certain resistance to vaccination. We had low vaccination percentages. So we agreed yesterday with the unions. They're going to help us with the messages with the employees to go get vaccinated. It's very important to have that agreement with our representatives from unions, because I'd like to repeat, at the beginning, we had perhaps about 50% of employees who wanted to get vaccinated. On average, we're now at 76%. But I repeat, the first CHSLDs, at the beginning, there were places where it wasn't as high. And those people have to raise their hand, and they can raise their hands. We'll go back to do the vaccination because it's important that our employees be vaccinated. And perhaps my last comment, and you've seen it for those who are following your executive summary, and I'd like to end with this. Every day, we still have good news as far as the postponements are concerned. We have gained 5 points as compared to last week. So that means that everything that was postponed, delayed, including our private clinics, went from 23 to 18%. That is very good news. So the fact that our hospitals are less busy means that we can take up a little bit of the slack. And once again, I want to say, with a lot of attention towards our employees, we are going very gradually. So to respect our healthcare workers, but at the same time to be able to conduct more surgeries, to be able to catch up. So we got a 5% increase this week. That's very good news. So I would like to invite, as the Premier has done, I would like to invite people to go get vaccinated, but as well to continue getting themselves screened. The variant is very dangerous, and I think that the more information we have on the variants and, the statistics, the percentage of statistics of variants, all of that information is on our website. So I would invite people to go get screened to make sure that we continue having good control over the variant over the next few weeks. So we have a half hour left for questions. In the United States, the CDC has said that people who have 2 doses can start seeing themselves without restrictions, without masks or physical distancing. I understand that here in Quebec, the parameters are when all people 65 and over will be vaccinated, even if it's only 1 dose. And what are the predictions? Is Easter realistic? For me, Easter is too early. We won't have covered enough. We have to take into account our own epidemiology, the variants, etc. So I'm not saying that we're not going to get to that kind of approach. We could get there, but keeping masks as well. There are different scenarios that are being studied. But I'd like to take this opportunity to reiterate a message that if you have symptoms, please get screened. The other element that is very important is that you understand that although we have lightened things up, it's important to respect the progression, to respect the guidelines if we don't want to have to go back. My objective is really for us to be able to go forward and to add, things so that the guidelines become lighter. and not for everybody to just go all over the place. And another thing, because of the variants, we do have variants in Quebec. We've been able, up until now, despite the variants, to see a decrease in cases even in the metropolitan area. But that is with very aggressive intervention. So what I mean by that is that you'll see potentially, if ever there are cases in schools soon, we'll probably act more quickly, close classrooms more quickly, ask people who are contacts of contacts to get screened, or isolating themselves before getting screened. So don't expect the same kind of interventions. It's going to be a lot more aggressive because we want to be able to gain time so the variant does not take over, and to be able to continue having some lightening of the guidelines. And, while people get vaccinated. So you'll see it's important to keep that in mind. It might even be more aggressive than what is on the site quebec.ca, because we're not going to wait for protocols to be updated before acting. Would the alternative of homeschooling, or not homeschooling, but remote schooling and classroom schooling, could that come to an end soon in the orange regions? Yes, quite. I think that, as we were saying, we still have a few days. We've just finished the spring break, but it's a very probable hypothesis. Mr. Premier, there's a short sentence in your speech where you said, and I'm going to piggyback on what Véronique just said, you're talking about home gatherings once the 65 and over are vaccinated. That's a little bit like the moral contract. Isn't there fear? I mean, shouldn't people have 2 doses before they meet? Well, you have to understand that the 2 doses in the United States, they are putting people in contact without masks and distancing. We're not at all there here. There's a way of meeting and getting together at home, probably with other elements in place. I also wish to say that it's not because you are vaccinated that you're protected right away. It can take up to 3 weeks before you have that protection, and it also depends on your physical condition. So I believe that what we'll do, and I understand very well the wish of the Premier, because he himself, like everybody else, we look forward to having people over at home. So we'll adjust our guidelines depending on the epidemiology that is specific to Quebec and, of course, how many people are vaccinated. 1 dose protects already a lot. The second dose is in the middle long term, but we'll evaluate everything. As a follow-up, concerning the vaccination, right now there are schedules of vaccinating hours that are left free because people don't show up. Shouldn't you do what they do in the United States and have a recall list to avoid that there be holes? Because this is a race, if I've understood what's been going on for the past year. The rates of appointments are pretty good, all things taken into account. We're talking in our main regions. I was looking yesterday. It's 1%, 2% or 3%, and you're going to tell me that out of 20,000 appointments, if it's 1%, we're talking about 20 appointments, but it's not huge. However, we are taking into account the greater number of vaccines that we're receiving, 200,000 this week. I prefer having more schedules and that people have more availability, because we had to almost smooth out our 100,000 over a 7-day period in order to not have, jumps like that. But now that we're going to 200,000, rather than having an average of 17,000, 18,000 a day, I'm targeting 25,000, 30,000 per day. So if we have 1 or 2% of people who aren't there, I don't find it so bad. We can catch that up pretty quickly. Now, if we saw that that there was an increase in people that you're talking, well, then, of course, we could have recall lists. But within 1 or 2%, I don't think that it's a big issue for now.
Monsieur le ministre, Dr. Arruda, vous aviez ouvert la porte il y a un petit peu plus de...
You opened the door a little over a week ago, Mr. Dubé, to the vaccination passport. And I had asked you a question at the press conference. Where are you at now with that thought process? And is that something that is with the principle that was enunciated by Dr. Arruda? Well, listen, who are you asking the question to? Well, both of us. Well, the last time you asked, and I think that I answered. But yes, but there's been 2 weeks between the two. Where are we at? Is that something that is being studied? Well, I can answer if you wish, but I had been very clear that I believe that in a context where our government wants to be more and more numerical, something that was given on a piece of paper to have a vaccination proof that we used to have on a piece of paper before, and now being able to have it on a phone, I don't think that there was anything extraordinary about that. So anyway, I talked about it and I asked that we do everything possible so that when it is possible to do it, it's done. But I think it's part of to have that information, to be able to make it like that. My question is what we understand by that. If it's for traveling, because there are some countries that require vaccination, yellow fever or things like that, it's also a way of having, vaccination, digitized. I think it's in that perspective. If it's in a perspective of giving access, differential access to people in a place or another, I don't think that the government wants to go there. There are perhaps companies that will decide that they will require vaccination to be able to have access to their premises, but I don't think that it's intention as such, because we believe, thankfully, taking into account the history, in Quebec, most people will be vaccinated. So we'll end up in a situation where circulation will decrease and it won't be necessary to control access to public places through a vaccination passport, I believe. As a follow-up, Mr. Legault, a year after the pandemic, what is the impact that you believe that this will leave on the public, on people's morale? You saw over the week an important protest of people who want to have more opening for sports and all that. A lot of people saying that it has an impact. So what will that leave, do you believe, on the moral aspect? Well, we have to make a difference between, let's say, the following month and after. I believe that, of course, as long as there are restrictions, people will continue being sick and tired of them. So after a year, it's harder than in the first weeks. Now, afterward, of course, there will be impacts on mental health of certain people. And already Lionel Carman is working very hard so that we have all the available resources to help those people out. But generally speaking, I believe that Quebecers have realized how important it is to have dinner with friends on Friday evening, to see and visit your family, to be close physically, to hug people. I think that we realize that human beings are social people, and I think that we are going to appreciate these meetings even more with our friends and our loved ones in the next few years. Concerning AstraZeneca, on the one hand, we're told that it's perhaps not adapted for people who are at a high risk of getting ill, but on the other hand, you're saying that you want to use it for people at home and those who are vulnerable. Which vulnerable people would be vaccinated with that vaccine, and are we comparing it, for example, people with a handicap? There's the example in the newspaper this morning, young people with cystic fibrosis. Could you give us more information about this? Maybe I'll let Dr. Arruda answer that, because those are really recommendations from public health. Something that has to be understood is that the AstraZeneca vaccine, it's important to say, it's very good vaccine. It is comparable to the others as far as preventing deaths and hospitalizations. Even the recent studies that took place in the field showed efficacy that is sometimes in situations even superior to the other ones. So it has the advantage of being able to be easily transportable. So clients who couldn't have been vaccinated quickly enough with other vaccines right now are going to be able to have access to that vaccine. And taking into account the fact that it is, as far as the other groups are concerned that you were talking about, people who are very often who are less than 60, etc., we have asked our immunization committee in Quebec to review, to be able to look at the target groups and adjust them. The following groups. But soon we're going to have so many vaccines that we'll be able to use the right vaccine for the right clientele at the right moment. And even if there is a sequence of 6 to 10 at the end, we feel that at some point it's going to be done, altogether. So it's difficult for me to tell you right now that, to tell you who is going to receive what vaccine. But we're always going to use a vaccine. So our deployment plan is shorter and shorter, taking into account that being added. It'll allow us to protect people whom we couldn't have. How many people complained that we couldn't, that some people couldn't go to a vaccination center? Now we're going to go and see them at home and vaccinate them at home and protect them at home. You've said many times, Mr. Arruda, that the measure of the curfew was good because it had showed itself to be efficient. Now in orange zones, it's not as early, but there doesn't seem to be any will to remove the curfew in the short or long term. Are you thinking of keeping it over the summer? You are projecting me in time. With COVID-19, when we talk about over a week period, we're at risk of not being able to say. So this summer is really far away still. I mean, I hope that in the summer we're not going to have a curfew, at least not in the same way. So I believe that the curfew is useful. It's still useful now, but all of that will be evaluated, particularly in function of how many people will have been vaccinated and the epidemiology. If in Quebec people, rather than, if people, instead of going all over the place, they keep respecting the guidelines and the hospitalizations don't start increasing, I think that we'll be able to adjust in function of things as well, of the, sun hours, because when we change the time, it has an impact. So I think that the curfew is not going to be there forever. I'd like to go back to your example, Mr. Legault, on having dinner with friends on Friday evening. Just to be clear, because the United States, what they're saying is that once people are completely vaccinated, they'll be able to get together without masks and all that. Mr. Arruda, the question of Veronique Price your answer wasn't very clear. When might we think in Quebec of being able to have friends over at home on Friday evening without a mask? What are the criteria? What I'm saying is that it could even be before people have received their 2 doses, because in the United States, if there are non-vaccinated people with a group of people who are vaccinated, they allow those people to be together. I can't give you a date. What I want to say is that we're very conscious of the effect of breaking the isolation in people that people are going through. As soon as our epidemiology is sufficiently controlled and that we have enough people vaccinated with certain guidelines that might not be, no mask and go and hug everybody and your grandmother, we'll probably be able to allow 2 families to get together as exists in other countries. But it's still too early for me to be able to answer you. And, of course, the CDC solution that was brought is being studied, but there could be another one as well. As a follow-up, Mr. Dubé, on vaccination, you've already used the analogy of a car. We talked about it earlier on. We see that in the past week, the number of doses that we have is higher than the doses that are being administered. You've already promised 250,000 per day. So what do we need? What is the problem that makes it that right now we can't go further than what we said? Well, first, we can. The 250 that you're referring to is 250 per week. I would love for us to be able to do 250,000 per day, but 250,000 per week is what we did with influenza. But I think that there are 3 elements that are important to remember. When we say that we received doses, in 1 week, very often we take it for granted that we get it on the Monday, but sometimes we get it on the Wednesday or Friday. So in 1 week, and I think that yesterday's example is perfect for that. If the doses that we receive today from Pfizer and AstraZeneca, I couldn't distribute them yesterday. But today, if you look in our inventory, I have 200,000 extra doses that I couldn't distribute yesterday. So we're always, playing catch up. That means that last week I got doses that arrived on the Wednesday, and I had 100,000 doses to put in front of us that we succeeded. 15 to 20,000 per day, which is about the average over 7 days. What we didn't want is to have a day when we had to close our screening centers. now that we have 200,000 and 300,000 doses delivered per week, we'll be able to, go up. And regardless whether we get them on the Tuesday or Thursday, we have more doses that are going to be coming in absolute numbers, and we'll be able to increase to 30,000 a day. So there's a question of time, but there's also a question of regularity. It hasn't been a long time, that we've been getting them. Just last week, we only got them 100,000 a week. So the real test is to go up to 30,000 and 50,000. The real test is when we get doses that come in regularly. And that is why this morning, as soon as we can increase the number of appointments, we do it because, now we had some more and we could get through them more quickly. Continuing on vaccination, we know that we're going to get more. There's more vaccines that are authorized also by Health Canada. If we remove the priority people and we concentrate on those 65 and over after that, so the general public, people 40 who are 50, when might they expect to start getting vaccinated? And as Mr. Arruda was saying, how will this great block of people, will it be spread out? Are we going to go by jobs, like teachers and police officers, or is it going to go along with age groups? Well, that is a question that I had from the Premier this morning. When are we going to... No, it's Perot. No, it's not Perot. But I'll tell you what I answered him this morning. I still have a lot of uncertainties. For example, in the past week of March, and I don't want to... In the last week of March, we're going to get 440,000 doses just that week. Well, if it delays things by 2 or 3 days, then I'll have to tell you that I have vaccines that are going to be in transit. I don't want to go too much in detail, but I'll have vaccinations that will be in transit that have to go up to Gaspésie region or the Greater North. So what I said to the Premier is I would like that by mid-May, we'll have all of our 65 and over done. And if we can have that, at least for the first dose, I'd like that. And I have to say that, give us the opportunity of getting regularity so that we can organize things. But when we do start getting regular doses of 400,000 doses per week, it'll be a lot easier. And we haven't had that yet. Mr. Legault, I'd like to hear you on Montreal because, of course, yesterday there's a lot of regions that went from red zones to orange zones. We're very happy about that. But Montreal, could we have a timeline, a hope, something? At what time will we be able to reevaluate the situation? When might they expect to have, certain lightening of the guidelines in Montreal? Well, we said we would reevaluate every 2 weeks. So technically, next Tuesday, we'll have a reevaluation and new recommendations. But I follow public health. And I'd like to public health notice that next week, we're going to be changing the time. So at 8 p.m., it'll be as dark or as light as 9 in the future. So I was saying that to public health so that they think about that. And seeing one's friends. And of course, as I was saying earlier on, once we'll have vaccinated all those 65 and over, and they don't want to give dates, these two too much. But let's say within a month, let's say, or a bit longer than a month. It's going to change things a lot, and we hope that we'll be able to announce good news in Montreal. Maybe just to say quickly, since this morning, we've been giving you the information on the percentage of variants. So, especially for the Montreal region, it's very important. 50% of variants are in the Greater Montreal area. First statistic. Second, for the past 2 weeks, so last week and this week, we went in Quebec from 14% of positivity rate of variants to 18%. That's almost half of what it is in Ontario. That means that Montreal, in particular, and when we have to congratulate Madame Drouin's team, they have succeeded, Dr. Drouin's team, they have succeeded in controlling the variant up until now. Because if we stay in those percentages, we're not yet, in the exponential. That's what we have to follow quite a bit. That's why I look forward to getting the results of the spring break. And I think that the Premier will be able to make important and significant decisions next week if we can control the increase of variants like Montreal has succeeded in doing, I would say, relatively very well up until now.
Bonjour à vous. On a beaucoup entendu dans les...
We've heard a lot in the past few days, Mr. Legault talk about the pandemic and go over the past year. Mr. Arruda, I'd like to hear you now. How do you evaluate the quality of the response of public health, the direction of public health to this pandemic in the past year, and how do you evaluate the management that you've made of this crisis? Well, just like in any situation, I would say that if we had known certain things before, we would have done them differently, but we always have to look at the context. I believe that we followed the expertise adequately. We followed science. In hindsight, some people are telling us, well, such and such article happened in such and such a date. Why did it take 6 weeks before? Well, when we make decisions that will affect the public at large, we have to have solid evidence. We were precursors in things, for example, vaccination with, protecting more people, like increasing the delay between the 2 doses. So without being perfect, because I cannot consider that we could ever be perfect, but I think that we always try to do the best for the Quebec public. Sometimes people, reproach me with the mask, but I think that having people start wearing masks, it's not something that we can do from one day to the next. We had to learn about distancing and hand hygiene. You know that when face coverings arrived, anti-mask movements started. When we face the public, it's not just one person, just one patient, it's entire category. We have to take people's behavior into account. So I think that we haven't done worse than elsewhere. And as far as vaccination, however, I am proud of the National Institute with the recommendations that they've given us. I think that having vaccinated many more people right now makes it that the outbreaks in CHSLDs right now in the second wave, I think that we are all very marked by what happened in CHSLDs in the first wave. Nobody can remain insensitive to that, to the suffering, to the mourning. And we're going to continue, even after the pandemic, to take care of those most vulnerable who had impacts in terms of mental health. I'll end here because the question period is ending soon. Yes, and we have many questions left, so very quickly, Mr. Bergeron. Mr. Legault, you said lately in a statement that public health proposed sometimes to you things that were not feasible. What has public health proposed to you that was not feasible? Inaudible comment in the room. I had an idea in mind when I thought about that, but it had to do with the schools, I think. Oh, yeah, it was to say half-size classes. Half-size classes, that means that we would have needed twice as many teachers. And I questioned the Minister for Education, and he said that it was impossible to have 2 times as many teachers, but it would have been ideal to have half-size classes. So it's that kind of thing that we talked about together to be able to see whether it was feasible or not. I think that's normal. Okay, we're really running out of time. Short question, please. Mr. Legault, we've been hearing on the radio for a few days an ad paid by the government of Quebec on the pleasure of moving at 100 years. Don't you think that it's a weird message with all the young people where it's like, it's beautiful to do sports and take advantage of it, whereas there's so many young people in Quebec that can't do sports? Well, I think that we can move. We can move outside. We can walk. We can run. We can, ski. The arenas are open. There are activities that we can do outside. We are reopening extracurricular activities inside. But yes, in fact, it is important to move, yes. But while respecting the guidelines, I think that it is possible to move. Mr. Dubé, on vaccination, if the staff is there, if the doses are there, could we go, could we consider to really, have vaccination open 24 hours a day and really go for it? All options are being considered. And do recall there are pharmacists starting to work with us next week, and that already, I believe, that the minimum that pharmacists are going to do once we get the vaccine is another 100,000 per week. I think that they can do a lot more because they've done even more than that during the influenza. But once again, we are limited by the number of vaccines that we have, but we could increase. Yes, we could increase by a lot. We have all the resources to do so. And we're still limited by time. I'm sure that you heard that on PEI they said that they would be ready to share their vaccines. Is the discussion being done between provinces that are not as affected, those less affected saying, we could give you some more and then come back in the summer, you can give, them back in the summer? I think that we haven't talked about that. We need our vaccines right now, but if there's anybody who wants to offer them to us, and that is why we said yes to AstraZeneca so quickly as well. No provinces have offered you any vaccines? No, not yet. Mr. Arruda, to hear you about the vaccination of children. There's the studies that have been made by Pfizer right now for teenagers 12 to 17, another study being done as well for a similar age group, but right now we're not thinking about that. So you're not thinking of vaccinating them? Is that what you're saying? Well, we'll vaccinate them if recommended, but right now it's not being recommended. And taking into account that the priority is to prevent complications, it would be later in the sequence at any rate. Last question in French. Mr. Dubé, you quickly selected a use for AstraZeneca for home vaccination. Do you already have the data that would allow you to say what the Johnson & Johnson vaccine is going to be used for? Not yet. We're going to wait to get the comments of public health. The British government proceeded or is proceeding to vaccination 24/7. Is that being considered? Do we have enough human resources and vaccines to do that? We're going to have all the necessary resources. We already have an extra 600 people who are recorded on Je Contribue. It can be evaluators or vaccinators. We're not going to have a lack of staff. What we need is vaccination. So the 24/7, it could be taken into account because the great vaccination centers, the mass vaccination centers, they can do it. That completes for questions in French. Now, English questions. I've been told that we can go over time a little bit. You've been pretty disciplined, so.
Madame Fletcher.
On the AstraZeneca vaccine, I'd like to hear your reasoning. The recommendation is 65 years and older should not be receiving that vaccine. You've decided to not respect that recommendation. Why?
Non, au contraire.
In fact, the vaccine is homologated for 65 and more. That's the Committee of Immunization of Canada who decided to don't recommend it because they find that they had not enough data, but we have actually data from other countries too, even UK, and others are using it after 65. And based on new data, and I think probably the Canadian immunizations will change their mind soon. New data, they protect against hospitalization and I would say and death for the elderly, even if they are more than 65 years old.
Can I continue?
La question commence.
Il n'y a pas de problème. Moi, j'ai juste répondu à la question du Premier ministre.
On me confirme qu'on peut poursuivre jusqu'à E5. Ça vient de votre cabinet, M. Legault. Alors, en sous-question rapidement.
Okay, yes. I'm also wondering about keeping race-based data and social economic data on people receiving the COVID-19 vaccine. For instance, how will you know if low-income racial minorities are being vaccinated if you do not collect that data?
We know, I would say ecologically, that where are the spots where there is those low economic without having it person per person. But I would say we will do the maximum to vaccinate everybody who wants to get vaccinated and use different strategies to go to be in contact with those populations.
Avantage de faire affaire avec les pharmaciens.
Of course, I think that it's a good thing to do business with pharmacists. Oh, in English, please.
Advantage of using pharmacists because they know their local clientele. And that's one of the reasons we accelerate the vaccination with the pharmacists because they know their area.
Rapidement, Matt Grill, CTV.
Afternoon. Just a quick question regarding the second dose of the vaccine. How long do you think before senior homes receive, all senior homes and all its residents receive a second dose of the vaccine?
It's actually, it's going to be 16 weeks after the first dose.
Okay. Do we have a timeline as to when that would happen?
The timeline exactly?
Well, what would be the latest date?
I would think as we just finished, it's about, I would say, around 13 weeks from now, from what I can see macroscopically. I must make some verification because we, I think, finished them 3 weeks ago. So we will have to add, I would say, 13 weeks.
Philotier de Gazette.
Premier, what would you, good day, what is the point, the magic point where we will be able to say the worst is behind us? Is it people over 65 vaccinated, number of cases? What is the magic moment where we will be able to say the worst is behind us?
But there are many factors, including the recommendations of Dr. Arruda. But personally, I follow the number of people of 65 years old and more, the ones that have been vaccinated. I think that it will be a complete new ball game when all of them will be vaccinated because, again, I repeat, 95% of the deaths are coming from this group.
Second question.
And Dr. Arruda, just a quick update on the variants. You were talking about sharks in the water. Is the situation any better in Montreal?
The situation is, I would say, uncontrolled in Montreal. It went a little bit up, I can say, but it's under control because we see that even if they get more variants, there is no cases going up. But it needs a very tough work of public health people and ask people if they get sick to get screened. And also, they will probably, if there is cases in school, there's going to be a more aggressive intervention by public health.
Très rapidement, Katsune.
Mr. Arruda, for people 70 and older, I understand that even though they received a dose of Pfizer vaccine, they cannot see their loved ones. They cannot see their families if they have received the dose and they are 70 and older.
For the moment, no. As I'm telling you, we're going to look at the new epidemiology, what is going to happen, and see in which conditions perhaps they can meet their loved ones.
You give a lot of hope to Quebecers today, Premier Legault, for 65 and older being vaccinated, that gatherings, indoor gatherings will be able to come back. But why have you not waited specific guidelines like what the CDC has done in the US to announce this to Quebecers?
But I think it's important that people see the light at the end of the tunnel. We know that we have some weeks that will be difficult in front of us. I'm asking people to continue to follow measures. I've seen people in the street about sport last weekend. So what I'm telling them is please wait for the next few weeks until all the people of 65 years old can be vaccinated, and then we can hope to have good recommendations and that we can ease the measure.
Il met fin au point de presse. Merci pour vos bons mots. Merci pour votre...
Thank you for being here, and thank you. And of course, Marco always has a tighter grasp on how the press conference goes. Thanks you very much.